information which you have given us. I now hand you over to Dr. Angami for the next innovations in human resource.
The Nagaland State Government and Christian Medical College, Vellore. So it's been now in existence for about 9 years, and we run about 190 beds. It's a small hospital, not very big, and we also have we have about 360 full-time staff and about 80 or so outsourced staff. And we also run a college of nursing and trying to develop a regional institute of paramedical sciences, a radiotherapy center, and hopefully we can develop an institute for children with special needs and an eye institute. So that's the long-term plans. We have a motto that's serve, nurture and transform. So serve, we are there because of the patient. We are there to serve the patient. Nurture, our staff are very, very important for us, and therefore we feel that the people that God brings into our institute, when they come, when they leave, or as they grow, it's our responsibility in the management to grow them to the highest potential that God has given to them, or God has created them to be. And it's a shame for us if a person comes to our institute, works for about 3-4 years, and 5 years down the line he remains the same. I think that's a shame on us. And of course, so we are really keen on nurturing our staff and also to transform, that is, transform how health is like in our state and region. Now, if you look at healthcare institutions, the various things you think about: infrastructure, manpower, processes, the philosophy, and the funding. Now, there are various issues which have already been touched upon by former speakers very well: recruitment, retention, performance appraisals, talent management, compensations, staffing and manpower planning, job descriptions, communications, staff and employee development, personal development, motivation, team building, participation, grievance redressal. And I think there are lots of very, very important issues, and it's a huge subject. I think one of the very important issues while thinking about HR is also to think about meeting the needs of the country. What does the country really need? We were talking about 600 medical colleges required to meet that manpower requirement. And I think if you make 600 medical colleges, it will not meet that manpower requirement, because almost all of them are going to again stay back in the cities, and the doctor-patient ratio is going to remain the same in most of the parts of the country. So I think there will have to be a rethinking of how we're going to meet that HR need of our country. Now, when you think about recruitment, you look at the huge talent pool and you try to get the best. People come for salary, perks, or you're a reputed brand, or you've got good facilities, or you've got good career growth pathways. I think one of the important things, and those are of course very, very important, I think one of the very important things we need to think about is vision of the place. And then the value and ethos of the organization, the leadership of the organization, and the organization's fundamentals and non-negotiables. I think these are extremely important while we join an organization. The vision is extremely important. Why are we here? What are we here for? Why am I joining this place? Where is this organization going? What are the needs of the people of the region when I join this place? Can I contribute to that? What are the needs of the country? And what will outlive us, and what legacy can we transfer, as a result of our being in this place? I think the vision is very important. When we join an organization, we need to get the big picture. A few years back, many years back, one of our senior colleagues, one of our mentors, he was saying, you have a lot of young doctors going to mission hospitals, and he used to tell them, don't say go and work hard, make sure you do a good job, make sure the salaries are paid. That's an insult to the intelligence of and to the potential of that doctor. What you should say is, think of how you're going to make a major impact in the region of that place, that town where you're going to stay. When you do that, you get a much bigger picture, and in the process, they will work better. Salaries will be paid, people's satisfaction will be increased, quality will improve. All that will improve when you're thinking on a larger scale. So the big picture must be important. We need to think legacy. At the end of, my stay here, what's going to happen? I worked in Kohima for 7 years after finishing my gastroenterology from CMC, and we did a good job, I think. We ran a good hospital, and a lot of people thought we were doing a good job. But I was thinking, what really impact have I made in the city that I live in, or in the state that I live in? And I thought, at the end of it, what legacy would we, really impart? And I felt we weren't going to leave too much of a legacy. So, that's one of the reasons why I moved off to Dimapur. I think we need to, the vision will determine how we grow and also how our staff grow, because everybody would need to be aligned to that vision. So the vision is not just a vision statement for NABH or something like that. It has to be something which is very dynamic, which pulls people, say, I just want to do that, It has to be much more gripping, and it has to motivate much more than that. And that will go beyond salary. That will go beyond a lot of the perks that we do. It will sharpen the goals, and it will also decrease the attrition. In our hospital, like many other hospitals, there is attrition. There's no doubt about it. But I think a large number of people have stayed on. And I've been thinking about why does attrition take place? I've seen. I went to Delhi many years back. I met a cardiologist, very famous and very good cardiologist. He worked in Fortis. 2 years later, when I went to see him, he had gone to Artemis. And another 1 or 2 years later, he had shifted to Medanta. For various reasons, I don't know what it was. I had friends in Gangaram Hospital, and the entire gastro team, almost the entire gastro team, shifted to Medanta. I also had friends who worked in Medanta who moved out from there, because they really couldn't digest the system out there. I've also, when I was in Christian Medical College, Vellore, we have, you have this Outlook magazine or India Today rating, of institutes. So you'll say number 1, number 2 institution, and when the staff were asked, what do you want our institution to be? Some of them said, we want it to be number 1 in India. And this mentor of ours said, that's a very, I wouldn't give him even pass mark for saying that. What he said was, don't say number 1, number 2. Talk about what you can do. There are two ways of managing. One is the Christian Fellowship Hospital way, and there's the rest of the world. And they do everything wrong, and it seems to work. Because the salary is poor, the living conditions are not that great, patient load is high, all kinds of things. But I think the reason why it continues to grow and the doctor numbers are just increasing is because they have a sense of commitment and a vision which is different from elsewhere. So the vision, I think, is very, very important. For retention, I think, we think, okay, you recruit, but now you need to retain your people, People stay in a place because it's a great place to work, but they find meaning in work. There are a lot of hygiene factors, working conditions. And then also a supportive environment and community. One of the things that we've been trying to work in our hospital is that we want to develop a community that supports each other, which will not just, we might not pay as good as some other people. We try to make sure that our nursing staff and the lower level staff are paid much better than the places outside. The doctors, of course, are paid much less. So we try to develop a community so that, and supportive community so that people might say, in that other institute I can get a higher salary, more this, perks, but I cannot get the community that will support me like this place. That is very important. I think teamwork is very important, and of course career growth and skills development. Now the other area which I would like to focus on is communications. In any institute, you will always have conflict, because wherever there are people, there are going to be conflict. If you say we don't have conflict, then you're telling a lie. If you look at communications in an institute, and that's what we have not been taught in our curriculum in MBBS, you think about, staff with patients, physician-patient relations. That's a huge chapter. We are moving off in India from paternalism to autonomy, slowly. So that's an area where it needs to be really studied very well. No, doctors have never been trained in it, and it's only many years later when patients start litigating us, suing us, then we think, oh, I need to learn better skills of communication. Staff with staff. Generally, doctors don't treat nurses too well, and between the staff also you can have a lot of problems, interdepartmental problems. Between two very good departments, both places, good people, hardworking, sincere, good at their jobs, but because of the pressure of work, they start, having conflicts, and then intra-departmental or management with the staff or staff with management. This is a huge area, and because of which people can leave. We've been trying to work at seeing how we can develop this, address this issue. So, Bangalore Baptist Hospital, they've developed a communication cell. In our hospital also, we've developed a communication cell with a group of various people to see how we can address this issue. And we are trying to empower ourselves, read up. We're going to start conducting workshops. We've started a few small workshops with some staff, and we're going to look at various issues of how all levels of communications can be looked at and improved upon. We're also rotating staff from front desk to lab. Nurses went to the lab to learn what the lab people, how they live and how they work, so that they understand each other better. So we're looking at various ways by which we can improve communications. Training is another issue which is been touched upon. Now training, there's so much of training now. Now, as I just took over as director recently, and I've been getting so many requests for training. Training is another issue which is been touched upon. Now, training, there's so much of training now. Now, as I just took over as director recently, and I've been getting so many requests for training, and I think, okay, training is very important, but what training is important? Which is the training which we really need to, invest in, knowing the big picture. Then, what is the methodology that we're going to use for, for training? Is it pedagogy or andragogy? What I've seen is that we've done a lot of training for Hospital Infection Control Committee, huge number of trainings, and we realized we're still making a lot of mistakes. Then I told our people, I said, no, we need to redo this altogether. We have to devise it in a different way so that it is effective. So we're doing that. So we need to review the efficacy of training, and then we need to also think in terms of leadership transition. I used to tell my other colleagues, I said, by the time you reach 50 years of age, if you're going to do, if you keep doing the same routine stuff that you're doing, you're insecure, You must not do the routine stuff. Do something else. Get the routine stuff to be done by your juniors. No, don't hold on to those skills and things like that. There has to be a system. So when you join, especially for, all of us are going to become leaders at some time or other. So as soon as we take on the position, from day one we have to think, what is the next, have to plan for the next leadership. So the leadership transition training is something which all of us need to learn. And then in our hospital, what we've been doing is we've been giving a lot of administrative training to a lot of our staff. So, we're giving leadership, administrative training to people who are in HR in the front desk. So we've been sending to the Christian Medical Association of India training, which is about 10 days training to Bangalore, Delhi, where they're taught a 10 days module of administrative training. And every year we've been sending 2 or 3 people. And so that a large number of people in the hospital know the broad spectrum of what hospital running is, not just the top leadership alone. So we hope that, and that is paying some dividends. Also, we need to have a training, HR training matrix. So at every level of staff that we say, at this level, 3 things they need to know, at least communications, various things. The top level, finance, administration, whatever, So develop a training matrix which we can be held accountable to, and the board of directors should look at this training matrix, and if they find that I haven't done this job well, they can hold me to task. So there needs to be a skills for each level. There needs to be a developmental roadmap for each of the staff. I was talking to the director of St. Stephen's Hospital some years back, and he said when he returned to his hospital once, he met a sweeper, and that sweeper said, "Sir, you know, I joined as a sweeper. I've seen a lot of staff in this hospital. They've joined as young doctors became big doctors, young nurses became big nurses. I joined as a sweeper, I left as a sweeper, you know." And he said his heart really, you know, broke as when he heard that. So that is where we need to develop a personal, you know, development action plan for each of our staff. We also need to have, you know, task shifting, like you were talking about multitasking, you know, where some of our staff, we look intensively and see what other talents can we take out. So we're trying to develop a talents database of all our staff, you know, to see what are the things which they are better in. You know, I was telling our nurse educators that let's develop a module, you know, a patient education module for every non-communicable disease. And they are doing it right now. We've reached about 7 or 8 now. But what we realized is the front desk person was very good in making cartoons. And now we're using them for that. You know? So there's a huge amount of talents in our hospital, and we need to, you know, discover that. You know, we need to. Performance appraisals can be a bit dicey, especially doctors. How to appraise a doctor, you know, very skilled doctor, because no matter what you do, the person will say, "Oh, you don't like me, I move." No, so fairness in appraisal can be a little difficult. I'm not going to talk too much on this. I think I will. I'll just close with this last part. You know, in our hospital, we realize again that we can't pay that much. You know, we don't have that much finances to pay very high. So what we thought is we developed staff welfare committees, and we're working on a crash, marriage seminars, finance training, talents development, music, recreation, Zumba, gym, fields, fishing, sports weeks, trekking, photography, cooking, quilling, celebrations of various occasions, praying, choir competitions, Christmas decoration competition, carnival, cultural week, social works picnic. So we're trying to do a lot of things to get staff to get together so that we try to get out as much of their talents as possible. I think what we really need at this hour is, the need of the hour is people building. We need to develop people. An organization is only as good as its people. They say one machine can do the work of 50 men, but no machine can do the work of one extraordinary man. I'll close with that. Thank you.